Hi, my name is Stefan Georgi, and I'm here today with Dr. Brent Reynolds of the New Life Wellness Center, which is in Smithtown, New York, along with Dr. Carrie Chiappino. Dr. Reynolds helps a wide variety of patients with their neurological and brain-based conditions. And today we're going to talk about concussions, which is an area of specialty and focus for Dr. Reynolds. And something that's pretty fascinating. You've probably heard about concussions before, whether from professional sports or any another avenue, the news. However, a lot of people don't understand exactly what concussions are, how they work, what they look like, and then also some therapies that can treat them. So, Dr. Reynolds, first of all, thanks for being here, and I guess let's go ahead and jump into it. Like, how would you define a concussion, or what really is a concussion?
Good question. A concussion is basically a brain injury. What happens is, whether it be a car accident or a sport injury or a blow to the head or a fall, the brain actually moves in the skull. And when it does that, it causes damage on either the sides of the skull or the front or the back because of the shearing motion. The brain can actually twist inside of the skull as well. And when you do that, you actually kill or destroy nerve cells within the brain, and that's where some of the damage comes from. A lot of people don't realize that even 5 miles an hour in a car accident can cause the head to go snapping back and forward. It's that transitional motion that causes the brain to jostle inside.
Huh.
So yeah, and it's a big problem now in adolescents and teenagers. Football, of course, we all know probably is the most common form of concussion or sport associated with concussions. And it's usually the person receiving the blow, not the one giving the blow. Because the brain kind of moves more, the head snaps more when you're kind of hit, especially off guard. The second most common sport, people don't realize this, is female soccer players.
Wow.
You would think, skateboarding or something like that snowboarding would be the top one, but really that's number two. So football's number one. Number two is female adolescent or teenage soccer players, and a lot of it's from hitting the ball with the head. You wouldn't think the ball would cause a mild concussion or brain injury, but it can. And the danger is not just one concussion, but what happens is a lot of times they get a concussion and they go back in after they rest a little bit. It's a mild concussion, and then the next concussion on top of the first one causes a lot more damage.
Why is it that a second concussion sort of is so much more damaging than the initial concussion a lot? Is there like a good, I understand it's another injury, but why does it really seem to amplify the effects of that initial concussion so much?
Usually it's because the first one hasn't healed properly. So you still have damage going on. Most people, when they get a concussion, they'll rest. The standard protocol is to rest about 2 weeks, do nothing, and then slowly, gradually get back into light to moderate type of activities, and then go back to full when the doctor says you're ready and your neuro exam clears. But a lot of people don't realize that it's a concussion. They just think they're kind of dizzy or they have a headache or a little bit lightheaded. They rest up throughout the game, maybe a few periods or a few minutes, and they go back out. Or they just rest for one day.
Right.
Most people will heal from their concussion, a mild concussion, within a couple of weeks. The concern we have are people that have post-concussion problems or symptoms months to years later. So it's a cumulative effect of those.
What are some kind of post-concussion symptoms that you can see over a long period of time, after the initial event?
Anything from headache, that's the most common. Headache, dizziness, lightheadedness, cognitive memory problems, confusion, nausea. They can have light sensitivity, sound sensitivity are very common. So people that get hit on the head and they have nausea, pretty much that's a real hallmark of a concussion. So.
Is it? It's interesting with the sensitivity. I was talking to Dr. Jason Pape, who's also a member of the Brain Core New York group, as you are, Dr. Reynolds, and we were talking about sensory integration, where someone has kind of almost the input that goes in is almost distorted. It seemed like
Right.
We're talking in regards to autism and things, but is that, I mean, maybe this is a kind of a curveball. I'm just curious, is that something like that could sort of be applied after a concussion where it could affect you, or is that something that's considered different sensory integration with concussions?
No, that's a great question. It's actually very similar. And what our brains do when you have a healthy brain, a lot of it causes a filtering mechanism. So a lot of the sound and light that come in is sort of filtered so that we can handle it and process it properly. And a lot of what your brain does is inhibit a lot of unwanted noise and activity. When you have a concussion or brain injury like that, you have no filtering or any kind of dampening of the environment that comes in, and so it's overwhelming. It's like a sensory overload almost.
Okay, cool.
Yes.
Yes, really. And then you guys, what you do with BrainCore New York and at the New Life Wellness Center, one of the therapies you offer is neurofeedback therapy through BrainCore. And how would neurofeedback therapy, kind of, what is it real quick? And then how would that be able to help with moderate concussion symptoms and sort of over the long run, especially if somebody still seems to be afflicted by the symptoms of a concussion after the event has already occurred and time has passed?
What we do, the first thing we do is we take a QEEG. We take a map of the brain wave pattern. So you have slow brain waves, and you have fast brain waves. And you have in between there. I call them like the neutral brain waves. So they all work in conjunction like a symphony. So if you went to hear music and you would hear it playing all together, it would sound really nice and everybody's playing appropriately. Well, what happens when you have a concussion or a brain dysregulation or dysfunction is that sometimes you get one part of the band playing their own song and another part of the band playing their own song, and it sounds sort of it doesn't sound like normal music or like a symphony like that. So we look at where in the brain they have this abnormal brainwave pattern. So in concussions, specifically in traumatic brain injuries, we see a lot of slowed down brain waves. So we can map exactly where they have them. And let's say it's in the frontal part of the brain. We can put sensors over that area, and the person can train those brain waves to improve using technology that we have. This state-of-the-art technology. Basically, they watch a TV screen. The TV screen lights up when they improve their speed of their brain waves. What I like about it is that it's an active process. In other words, a passive therapy would be you show up, the doctor does something for you, and it improves your brain function. Those are great, but BrainCore therapy, neurofeedback, is active. The person comes in, we hook them up with the sensors, and it reads their brain waves, and they do a lot of work. Somebody said, the other day, the results you get are too good to be true, and I said, well, if you think about the process of it, it's really not, because the patient is really working over the course of 30 sessions. They're retraining their brainwave patterns. Right. We can do it very specifically. It's sort of like if you went to a personal trainer and you went to and they worked you out, and you put in a lot of effort and time in the gym, and you would see results over 30 or 40 visits. It's the same thing. It's like a workout for your brain.
Sure.
It does. We have seen tremendous improvement. I've had patients with traumatic brain injuries who couldn't walk or couldn't move one of their legs, and we put the sensor over the area of the brain that moves the leg. And if we told the patient, go home and move your leg, they would have no feedback. They would look at the leg, and the part of the brain says, well, heck with it. I'm not going to move that leg. I can't. I'm not getting any movement there, so I'm not seeing it move. We put the sensor over the area of the brain that moves that leg, and the feedback they get is from lighting up the TV screen, and over time, it tells the brain that area is actually becoming more active. So it's a different way of feeding back to the patient that they're actually, and then over time, we've had that patient move their leg. So just after 7 visits, they were able to start to move their leg. And now she's walking on her own now.
That's crazy. That's amazing. And yeah, I think obviously when you think about neurofeedback, the word feedback, then it makes sense. And yet I almost, I've talked to you and some other colleagues, but I almost forget too that really is the most kind of well, one of the neatest parts of the whole process is that live feedback. That's the whole, kind of secret thing here, the secret sauce, if you will, is that you
Absolutely.
are able to measure it, and because of that, you get instant feedback on what your brain is doing and the signals and how it affects the rest of your, your body, and that's pretty cool. That's really interesting. And the other thing, I guess, what you touched on with as far as the different sessions and like a trainer, I mean, now neuroplasticity, that concept has just been proven so much and time again, which is that you can train your brain. And so it would seem like with people who are like, how can you do it? It's the same reason if you go to a trainer 30 or 40 times and you don't see some results, there's something pretty darn wrong with that trainer, I would think, right?
Exactly. And just like going to a personal trainer with the weakest area of your body, we can actually just train the weakest parts of the brain. And the cool thing about the brain is that when you start getting these things back online, the whole brain sort of gets on board again, and that's the really great thing. And that's why there are virtually no side effects with this. Unlike a medication, let's say the person has attention problems. They give a medication, it speeds up the entire brain. It doesn't discriminate with one particular area. What we can do is work just that one area that's slowed down and not speed up the rest of it, and we eliminate the side effects by doing that. So it's just like a workout.
That's awesome. Yeah, and just to enroll with that workout analogy even more, if you lift weights, for example, and you're trying to make your arms larger, if you lift your legs, you'll actually end up having your arms get bigger too, because you're kind of increasing more overall mass, you're releasing testosterone, all these different reasons. But the point is, it's like, yeah, the overall health benefits, you can isolate one area and get tremendous benefits there, but then it also will lead to all these additional benefits for the rest of the body, or in this case, the rest of the brain, it seems like.
Right. And there's such a huge need nowadays because there's about 2 million people that suffer concussions per year.
Wow.
A huge percentage of those have ongoing symptoms later on. And medication for these things, it may help temporarily, but it's not actually addressing and correcting the damage that's been done. And most of this damage, by the way, you can't see on MRI. All the testing and the brain looks normal on a picture, but the function is disrupted. And so they go from doctor to doctor and they say, well, we've looked at your MRIs and we just don't see anything. We don't know what's causing all these symptoms of dizziness and confusion and difficulty with concentration and all the other symptoms that go along with these.
Right. What what kind of medications, or how are medications for concussion supposed to even work, really? Do you know kind of what the common gist is with those? I mean, obviously, it sounds like neurofeedback is preferable, but what would they even do for that from a medication standpoint?
Well, I mean, I think, in certain instances, medications are warranted, especially with seizure disorders and things like that. People can have seizures. It really depends on what's actually what the symptoms are. Seizures would be number one. In certain cases, you do need to control that with medication. But for chronic things like attention problems, they give the Adderall, Ritalin. For headaches, migraine headaches, Imitrex and the different migraine-type medications that they give. So it depends on the individual and the symptoms.
Sure.
Yeah, cool. Nobody I know wants to live on medication.
Absolutely not. Especially if you have a better option out there. So perfect. Well, I really am enjoying this conversation, and I'll let you go here. But if people want to speak to you about their concussion or traumatic brain injury, or really any brain-based issue that they have, or they'd like to find a drug-free, non-invasive alternative, with neurofeedback and BrainCore, what's the best way for them to get in contact with you?
Sure. Our website, newlifechiropractic.com.
Cool.
You can give us a call at our office, 631-265-1223. There's also BrainCoreNY.com. You can find us on the web like that. So
cool. And I'm putting underneath this video here on YouTube a link to the your page on the BrainCore NY website as well. So cool. Well, thank you so much for taking the time to speak with me today, Dr. Reynolds. I really appreciate it.
Thank you very much, Stefan. Thank you.
Absolutely. Thank you.